Hello everyone. Today we are going to discuss about sensation. What is sensation? If you don't know, go through this topic. Okay. There is five sense organs in our body like touch, vision, hearing, taste, and smell. Okay. We'll go forward. So, coming to definition of sensation, it is the process by which we receive information from the environment. In that definition, they are telling it is a neurophysiological process that perceives sensory stimuli from environment to brain. So, coming to purpose of sensory testing. Okay, if any sensory loss is there, if any like hearing problem, anything is there, that we have to determine, and any impairment, any functional limitation is there, for that only we have to do sensory testing and determine the time to begin sensory re-education and desensitization. Sensory re-education like sensory retraining. Okay, I think we know about sensory retraining. Sensory retraining helps to interpret sensory information accurately. Okay, and it will help us to at what time we have to start sensory re-education and desensitization, and it will prevent further injury. If we have any injuries there, it will prevent. Okay, for that we have to do sensory testing. Next slide is type of sensation. There are three type of sensation: superficial, deep, and cortical. Superficial is touch, pain, temperature, and pressure. Deep is vibration, proprioception, and the kinesthesia. And next is cortical. There are six sensation like stereognosis, barognosis, graphesthesia, two-point discrimination, tactile localization, recognition of texture. Everything we'll see next slide. Okay. So, in superficial, first one is pain. I told already. So, what is pain? Pain is a normal sensory signal that something might be wrong. Okay. So, in that definition, they're telling pain is an unpleasant sensory and perceptual experience that is associated with either actual or potential cellular damage. Okay. We'll do that the test pain. How? So procedure is like first you have to take like safety pin. Okay, that safety pin we have to like first to do unaffected side hand. Okay, unaffected side hand, and the amount of pressure like how much amount we are keeping that also we have to see. Okay, that examiner will see how much pressure they are giving. So what response will get like the client have to tell they are feeling that sensation or not. In according to that we have to do scoring. Okay, a correct response to both sharp and dull indicate intact protective sensation, and incorrect response to both sharp and dull indicate absent protective sensation. I think you clear about that pin how we have to pin we have to check. Next is touch. Okay, in supervision, next is touch. So how we have to do? We have to take cotton ball or fingertip or pencil nib. So stimulus we have to give light touch to small area of the patient skin. Okay, and response how many times we will give that stimulus, like the patient were feeling that stimulus or not, they have to say yes. And scoring according to number of stimuli they we have to give score. Okay, you can see two picture. The first one they are doing for pain sensation, they are taking pain and they are doing for pain sensation, and second one is for touch, they are taking cotton and they are doing for touch sensation. So next one is temperature. For temperature, we have to take test tube or metal cylinder with hot and cold fluid. We have to give them we have to give them that. According to that, we have to do scoring like a correct response to both cold and hot indicate intact temperature. Incorrect response to either or both indicate impaired temperature awareness. Okay. Next one is touch pressure. Light touch is perceived by receptor in the superficial skin. Pressure is perceived by receptor in the subcutaneous and deeper tissue. So I think you all clear about superficial sensation. Next slide we will see deep and cortical sensation. And thank you so much for your patience. Okay.